Hi, I'm Dr. Danielle Mark Collins and I'm Clinical Director of DermaFace MD Skincare and Clinical Director, Medical Director of DermaFace Clinic since 2009. And I'm going to do a part 2 on smokers' lines because we got so into the whole detail of it, and I'm so excited to explain all of this to you and to provide education to people so that when you go to an injector that you can ask the correct questions and you can ascertain if they're good and they know what they're doing. So like I said, quick recap, there's two types of lines, static lines and dynamic. Remember static, I remember stationary, static. So those are the lines that are present when we're not moving. So you might have nasolabials, marionettes, whatever. If you haven't had Botox or you're a little bit older, you might have crow's feet here. Dynamic, again, are lines that occur when we're moving. So when I raise my forehead, I have dynamic lines there. I know I need my Botox done. I've already explained I had Mohs surgery to remove a basal cell carcinoma, so I'm a bit squeamish at the moment. I could have had it done beforehand, but I was just too busy. I would suggest there's dynamic and static lines, and in smokers' lines, that is the case. You have a combination of the two, so we need a 2 or 3 prong approach to deal with them. Also as well, smokers' lines can come from someone smoking or vaping. It can come from a non-smoker, can also get smokers' lines if someone's just a little bit talks like that, or they're inclined to purse their lips. Maybe too many selfies. We're all, well actually I don't do selfies. But the other type is somebody that used to smoke or vape and then gave up. The other person who's at risk of having smokers' lines is a bona fide Botox Karen that goes around angry all the time with pursed lips. So that's the categories that can have smokers' lines. Anyone can have them. I think I just have a few lines when I'm relaxed at the moment. I haven't had lip filler in about 5 years. Again, I'm naughty. I use my triple peptide eye cream and my crow's feet, and I use it along my upper lip as well. But it works really well. It's loads of oligopeptides. So basically, the first thing to do, as I said, was to have filler along the vermilion border, which is where the pink, in my case, I'm white, where the pink meets the white skin, but whatever color skin you are, you'll know the vermilion border because it's where the pink of the lips meets your skin. So you have filler along here, you get a good injector. Hopefully they catch the little tube here and it just goes all the way up there and you only have one injection, boom. It goes in this side all the way up there, one injection, boom. Again, if you have scar tissue, it'll be more tricky and you have to massage, or if you have something crazy like silicone, don't even get fillers. But supposing all things go equal, you've got a band of filler here and a band of filler there, and it won't allow you to make the problem worse. The next thing then is if you have little smokers' lines across the vermilion border, again, where the pink meets, in my case, my white skin, you inject upwards, everything up. And again, just little bolus. And again, be very careful to have a good injector, like 0.1. And again, each bolus of the product will attract 1,000 times its weight in water. Don't overfill, because we know HA attracts 1,000 times its weight in water. The next thing to do then, once that's all perfectly solidified and solid in that area and secure and locked down, I'm going to have to do a part 3. I'm so sorry, guys. I'm doing it for you straight away.